Good evening, everybody. My name is Dr. Nathan Thompson with Exemplify Health Center, an affiliate of the Wellness Way right here in Yorkville, Illinois. Just about 45 minutes outside southwest of the city of Chicago, in the Chicagoland area. Hope you guys had a great weekend. Hope you guys had a great day today on Monday. I am just finishing up with the office, a busy day, and I'm ready to help you guys learn and help you guys be able to see a different perspective. If you guys are joining us right now, hey, please say hello. I always read pretty much every comment. I know I can't respond to all of them, though we try to. We have a couple of people who actually help us out with social media and helping us to respond if people have questions and things like that. But I almost see like almost every comment, and I appreciate all of them. Well, most of them, because not all of them are kind. But that goes with the territory of being on social media. So I'm going to go over a really awesome topic today. It's probably something that your doctor had never talked to you about, never sat down and gave you any kind of direction or post-operative care when it comes to I had my gallbladder removed. What do I need to do right now? I'm going to show you guys that. I'm going to explain to you actually why you lost your gallbladder. I'm going to explain to you why it happens more in women than in men. I'm going to explain to you why so many people today have gallstones that are leading to gallbladder dysfunction. And guys, a lot of times we think that it is a problem with our gallbladder, and it's not. The real problem is actually with what's making bile, and the gallbladder is storing the bile, so the problem really has to do with the liver. And I'm going to explain to you the biggest area that you need to look, whether you have your gallbladder or whether you don't, because there's a lot of people that are on their way to actually having their gallbladder removed especially. So I'm going to tell you guys what you guys need to do right now. And guys, if you know someone who has lost their gallbladder, please do me a favor and tag them in the video or just share this to your profile. Because there's a lot of people, I didn't realize this, how many people have gotten their gallbladder out who are suffering and who think that the current way that they are suffering is really what is their new normal, and it's not normal. And I'm going to show you some things that can even, yes, if you've had your gallbladder removed, that can start to help you tremendously. So guys, again, if you're joining us live, make sure that you say hello. Also, please let me know where you're watching from. So I know we have a lot of people from all 50 states, a lot of people from Canada. Hi, Canada. How are you doing? Apparently, too, someone had told me that that we have basically gotten banned in the UK and in Australia, which doesn't surprise me considering some of the draconian things that they have done, which means because we have been missing some of our wonderful people from Australia especially. So these videos may not be able to make it, across the Pacific Ocean or across the Atlantic Ocean. I hope that it does. I hope things change if that is in fact true. So guys, I'm going to talk to you about the gallbladder first before I do that, and because it got me to thinking, is we've had videos that have been shadow banned on Facebook, which means that they don't allow you to be able to share it anymore. You can't send it in Messenger. People try to comment and their comments disappear. Just a lot of weird things that are happening. So yes, I do know that under the surface, their algorithms are suppressing what we do. And in fact, my good friend, Dr. Patrick Flynn, his page has been basically wiped off the face of the planet for really saying nothing different than what we say on this page as well. So if we disappear, I'll let you know. You can find us in different places. Please make sure that you go and you can seek out some of the different things that we're putting on some of these other social channels. The first one is actually TikTok, guys. I held off on TikTok for a very long time just because I didn't really understand it, and I thought it was for kids, but actually TikTok is a pretty good platform for the most part. But a lot of times, guys, if you want to see some quick hits as far as what I talk about on lives, I've been doing 1 to 2 minute videos that are kind of summarizing what I'm going to go over with you in long format in this video. So if you want to go on the TikTok, just make sure that you follow. You'll find us on Dr. Nathan Thompson. Go on TikTok. I have a lot of videos on there, a lot of videos that have gotten traction. We have one video with about 700,000 views. And I will say that 90% of the comments are warm, they're encouraging, they're nice, and then boy, 10%, sometimes I think, TikTok is a new place where a lot of the trolls tend to hang out. And so there's been some pretty interesting and mean, just quite honestly, just some mean comments on TikTok. And my wife always tells me, she's like, you got to have thick skin to be able to do that with some of the things that people say. Just remember this, guys, is we don't feed the trolls. But just remember, if someone has a comment, like that, maybe this affects you as well, is just remember that hurt people hurt people. Take that to heart. Hurt people hurt people. I guess I just don't get mad. I don't get upset because when other people hurt a person, they need to spread the hurt to other people and make other people feel as miserable as them. And unfortunately, I guess I feel sorry for them more than anything else. So TikTok, you can go to YouTube. All of these videos that we do live, we put onto YouTube as well. And they're archived on this as well. So you can find these videos, almost all of them, on YouTube, but we have had a couple of the biggest ones that we've ever done have been taken off of YouTube. And I'm basically just about one strike away from getting removed from YouTube. And if that's the case, we're also on Rumble as well, which is another video platform. They do not censor. And so we've been uploading our videos on Rumble. So all you got to do, guys, Dr. Nathan Thompson, search that out on TikTok, on YouTube, on Rumble, and then we're also on Truth Social. So a lot of times we'll post the links, and I can be a little bit more truthful, I guess, and a little bit more brazen, I guess you can say, on something that doesn't censor or shadow ban or things like that, like Twitter or even Instagram, things like that. And so join us on Truth Social. I hope you guys are there. It's going to be a great platform coming up. So make sure that you guys find me there, and make sure that you also say hello, okay? Now, we always get comments of people reaching out on Messenger, people reaching out on email, people reaching out everywhere, and they say, hey, can you please help me? I'm not looking at people and saying I don't want to help you. It's just that right now I physically cannot find any more time in order to help people, nor can I overburden my staff any more than they are right now. So I need a staff that is that's fresh. I need to be fresh as well. So really, we have really limited our remote consults that we're seeing, from people, because a lot of people from Canada have reached out. A lot of people from across the country has reached out. We've had people from Canada or from Australia that have reached out, from Europe. And my schedule just doesn't allow it. I wish that it could, but it can't, at least for right now. So one of the things I want you to do before you reach out to me is, guys, make sure that you're going to thewellnessway.com. Okay, let me say that again, thewellnessway.com. The reason why, because if you go to thewellnessway.com, you can go and click this button right here and it says consult a doctor. And so they have doctors who are available for remote consults, so you don't have to be literally within a physical distance of a Wellness Way, although for us we prefer that. But I do remote consults. We're not taking on any more right now. But you can find a doctor who thinks like me or thinks along the Wellness Way approach. And guys, I will tell you, this is not something that a lot of the stuff I didn't come up with my own. Credit needs to go where credit is due. And actually, Dr. Patrick Flynn is one of my mentors, and he is the guy, really, the gentleman, the doctor that really inspired me to start thinking differently with a Wellness Way approach. And then on top of that, he's really has inspired me over the last 3 to 4 years to really dedicate myself to learning, to be able to teach, and to help people to start to think differently. Guys, one of the reasons why I'm so passionate about this really came down to my wife getting sick, and me not knowing how to help her. That is one of the most humbling experiences ever, is for a husband and for a doctor to know that his wife is sick and not know where to start as far as getting her well. So my wife actually suffered with 3 different autoimmune reactions taking place, was in bed for 12 hours a day, couldn't hardly do anything, had no energy, extreme fatigue, rosacea, like all over her face. She's the first to tell you that. And I besides giving her basic lifestyle advice, I didn't know how to test it properly. I didn't know how to do it. And Dr. Patrick is the one that I sought out and helped me through the process. And he said, as soon as you get your wife well, you're going to become a Wellness Way doctor. He said, you won't be able to practice anywhere different. And so yes, it's a lot harder. Yes, it's a lot more time consuming. Yes, you tend to put yourself out there and take a lot of the hits from people who don't want to see a different perspective. But if it helped me to be able to help my wife, then everything that I do beyond what I'm doing right now was 100% worth it. It That's 100%. And I know that there's a lot of other people who have wives that are sick, who have mothers that are sick, fathers that are sick, who have sons and daughters who are sick. And the Wellness Way is leading the way in helping people think differently when it comes to their health. So make sure you go to thewellnessway.com. And you can also, guys, please watch Dr. Patrick's A Different Perspective every Saturday morning at 8 o'clock. You will find it on this website because Facebook messes with it all the time. These other social platforms mess with it, and it's only because he's speaking the truth from a different perspective that doesn't line up with the current narrative. And that's what's sad, is free speech truly doesn't exist today. But every time that you try to suppress free speech, you try to suppress a different perspective, it actually makes people more curious. And that's what's so interesting, is that when you have people who try to call me out, try to call Dr. Patrick out, who do hit pieces, it only expands our reach. That's the only thing that happens, which is why I don't mind that much and I'm willing to handle it. So guys, please go to The Wellness Way and then make sure there's tons of articles, but then you can also make sure you're watching A Different Perspective every Saturday morning at 8 o'clock. Dr. Patrick has tons and tons of some of the people that you follow. He has them on as guests, and he does a wonderful job of doing the same thing that I do every Monday evening at 7:30. So guys, let's get into it without further ado. Help, I lost my gallbladder. Here's what to do right now. And again, guys, if you're watching this, please make sure that you share this video with someone that you know, because this has the potential to help people find the right direction and help them not to have to suffer needlessly. Okay, now let's talk about gallbladder removal. Okay, and this comes from the National Institute of Health. Where'd you find it, Dr. Nate? I found it, well, I did a DuckDuckGo search or a Google search, and I found this on the National Institute of Health, National Library of Medicine. In this article, which actually was updated this year in 2022, what they talk about is the benefits of laparoscopic surgery for the gallbladder, that being better than doing an open surgery for the gallbladder. Okay, so they used to do an open surgery, now they do it laparoscopic procedure, which doesn't require all the cutting, doesn't require opening up the whole abdominal cavity. And, you know, basically they're bragging on how this procedure is so much better. And the reality is if you can find ways to put out a fire better, that's less invasive, I say go for it. But here's what I find so interesting is, you know, doctors will argue on who can put the fire out better. Okay, they're saying, this drug is better. No, this treatment is better. This surgery is better. And I look on the sidelines or from afar and I say, you guys are arguing who's better at putting out a fire. And here what I'm trying to do is just to make sure that, number one, if there was a fire, what caused it so that it doesn't happen again, or we're trying to get you from not needing the fire department, or if you did have a fire and the fire department put it out, thank goodness, then who is rebuilding the body afterwards? And in fact, this is what's going to interest a lot of you, because you've had your gallbladder out and then it was just like, okay, you're good now. Let's just, you know, you recover. You're just live your life as normal. But there's a lot of people that are suffering who have their gallbladder out. And the reason why is because the doctors don't actually understand the physiology of bile acid metabolism, the physiology of bile secretion from the gallbladder, the purpose of the gallbladder, and actually the other hormones that are involved with the secretion of bile into the small intestine that causes the breakdown of fats that allows you to be able to absorb some things. And guys, this comes from Guyton's medical textbook of physiology, which is so crazy because I'll have someone who comes and says, I'm an MD and this is nuts. And I'm like, but I'm actually quoting your physiological textbook that you should have read when you were in medical school. Is it now and not, does it not make sense? Has it changed? Has the body changed? Has physiology changed? And a lot of times is because doctors don't study physiology. They study treatments that, you know, here is what you do for this. That's the treatment, versus actually understanding what's going on with the patient. So in this article from the National Institute of Health, they talked about laparoscopic surgery, blah, 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 blah. But here is the thing that they say. They say approximately 20 million people in the United States have gallstones, okay? So what is a gallstone? Well, if you look in the gallbladder and it's basically concentrated cholesterol, that has formed some kind of stone. Most stones are actually concentrated cholesterol. There's some other things that it can be. It can be bilirubin and things like that, but most of them are concentrated cholesterol. So 20 million people in the United States currently have gallstones. Of these people, there are approximately, now listen to this, 300,000 cholecystectomies or removal of the gallbladder that are performed annually. 300,000. So take that over the last 20 years, and really 20 or 30 years potentially, you could have about easily 9 million people who currently don't have a gallbladder in the United States who have been given absolutely no direction on how to make them actually start to feel better. 10 to 15% of the population actually has asymptomatic gallstones. So think of that, asymptomatic, which means they have dysfunction in bile acid metabolism and they're headed towards having some kind of obstruction and they just don't know it yet. So guys, when you're talking about gallstones, we think it's a problem with the gallbladder, but in reality, it's a problem in the liver because the liver is what is making bile. That's very important for you guys to know, okay? So let me ask you guys the question is, what does bile do? What does bile do? So all you have to do is open up your textbook of medical physiology to understand the purpose of bile. So bile is created by the liver. The gallbladder is actually, through these bile ducts, it filters its way into the gallbladder to be used as a storage tank so that you have enough bile to do the function of what bile does. Bile's function is to break down and emulsify fats. Now, you need some pancreatic enzymes in order to be able to break them down, but bile acids actually help it to break down even further. So what does bile do? It helps you to break down your fats, number one. Bile is also needed for the absorption of your fat-soluble vitamins. This is so important. So what are your fat-soluble vitamins? So things that need fat, that are stored in fat cells and need fat in order to be absorbed, your vitamin A, your vitamin E, your vitamin D, your vitamin K. So guys, if you've had your gallbladder removed, I'm going to tell you something that chances are you are extremely vitamin D deficient amongst things like vitamin K, vitamin E, and vitamin A. So guys, if you know, how do you know if you're vitamin A deficient? Well, most people have very poor vision at night, and one of the telltale signs that you're vitamin A deficient is that you have poor night vision. So you're going to be deficient in those things if you do not have a gallbladder and you don't have the ability to be able to store enough bile to absorb the fats that you're eating. So what happens if you lose your gallbladder? Well, you're still making bile, but you don't have the storage tank, which means that your liver is constantly secreting bile into your intestines all the time. Now, here's what bile also does. So, let me tell you what the gallbladder does, because I already gave you kind of a preview. But what the gallbladder does is it basically acts as a storage tank. Now, it's also a sensory organ because it will respond to specific hormones in order to contract or to not contract. So the gallbladder is what allows you to be able to store bile. Now, the reason why storing bile is so important is because if you don't have a gallbladder, you are constantly secreting bile within your intestines. But if you have a gallbladder, now you can actually store it so that when you eat and have a meal with a high amount of fat, it allows to be able to have enough bile to be able to break down those fats and to be able to absorb those fat-soluble vitamins. Now, the other thing why this is so important is bile does a really important job in actually regulating your gut bacteria. So what's interesting is that if you don't have a gallbladder, one of the things that can actually take place is that you can develop what's known as a small intestinal bacterial overgrowth, because bile in larger amounts actually help to keep that bacteria within the large intestine versus giving it a better environment for that bacteria to start to populate within the small intestine. I'm going to show you a very interesting stool test from someone who's been having some problems with their bile acid metabolism and also the removal or the secretion of bile, but also with a problem with their pancreas as well. So the gallbladder acts as that storage tank. Now, I'm going to give you, we call this a Swiss watch fact. Maybe I should bring this every week. A Swiss watch fact. The reason why is because so many people think that everything when it comes to their body is just basically a this for that. I want to lose fat, eat less. I have pain, take a drug for it. Well, I don't want to take a drug, take turmeric. And then realize that, wow, it doesn't really work all that well. And rather than say turmeric doesn't work, what I'm saying is that you have to stop thinking that you need to take this for that and start understanding how every single body process starts to work together. You got to understand that hormones don't make you sick. Hormones make you feel sick, but there's something else that's making you sick, and hormones are actually responding. There's a reason why that you have small intestinal bacterial overgrowth. There's a reason why you have a large amount of food allergies. You know, when someone says has food allergies, it's not because God says, I'm going to give you an allergy to these foods and it's just by mistake. There's a reason why. And the reason why is you're eating foods in a gastrointestinal barrier that is inflamed and damaged, and the foods that you're eating, those proteins are actually leaking through. And so the same thing happens when it comes to the Swiss watch and your gastrointestinal system and actually bile. And here's what's really interesting. Bile secretion. This comes from, guys, again, Guyton and Hall's textbook of medical physiology. So at least I get this week alone, just Sunday and Monday, probably 15 really nasty comments from people who don't attack the argument, they just attack me as well. And again, guys, remember, hurt people hurt people. And so if you want to know the maturity of someone, give them a perspective that they don't agree with and see how they actually treat you. So bile secretion is dependent on even stomach acid. And here is why, is that when you are producing enough stomach acid and it's sterilizing the food in the stomach and it's breaking down the proteins, and the body says, okay, this food has been sterilized enough, the proteins have been broken down enough, and it makes its way from the stomach into what's known as the duodenum. In the duodenum, remember, you have this bolus, is what it's called, of this food that's very, very acidic, and it can't stay acidic. Otherwise, it would burn your duodenum. So one of the things that happens in the duodenum is that there's this hormone along the lining of the duodenum called secretin. That secretin then sends a message to the pancreas to release what is known as bicarbonate. And so, or bicarbonate, I should say. So this bicarbonate actually will then increase the pH back up to normal, about 7.5 to 8, because now then, otherwise it would be burning the digestive system all the way down. So it secretes this bicarbonate from the pancreas in order to bring the pH back up to reduce the acidity. And the amount of this bicarbonate that gets released, the more that is allowed to release, which means the more stomach acid that there is, now that's dependent on how much bile acid is released. So if you have poor stomach acid function, poor stomach acid, the number one reason for low stomach acid is actually because of multiple kinds of stressors, including mental stress. This will even affect how much bile that your gallbladder is actually releasing. So it's really interesting to see how all of this actually starts to play. I don't know how much it has to do with what I'm going to talk about, but I just wanted to show you that literally everything works together like a Swiss watch, and you need all of those pieces of the Swiss watch for everything to be able to work the way that it's supposed to. So let's talk about who loses their gallbladder, okay? Now, guys, this is taught in medical school, this is taught in chiropractic school, this might be taught in naturopathic school. This is taught because basically the first year and a half, we are learning biochemistry, anatomy, physiology, we're learning diagnosis, whether it comes from musculoskeletal, neurological diagnosis, physical examinations, things like that. And so when we talk about who loses their gallbladder, in fact, one of the telltale signs that someone is having a lot of gallbladder issues is actually that they can have pain, a lot of pain underneath the ribs. They can have pain on their upper back, especially behind their scapula or their shoulder blade. But also too, you're having some gallbladder issues, especially if you eat a fatty meal and you are having some issues with bloating and with nausea especially. Now, we've had young kids, I'm talking like 18, 19 years of age, that were vomiting every time that they ate, and actually vomiting 3 to 4 times every single day. And the Mayo Clinic actually couldn't even figure out why it was happening. And this was a young male. He was having problems with his liver and with his gallbladder, and it had gotten so bad that his bile duct developed a polyp because things were so bad. And then on top of that, he had gastric erosions taking place in his esophagus because he had been vomiting so much, and that stomach acid was coming up and absolutely destroying the tissue. Now, the good news is fast forward about a year or so, and he doesn't throw up anymore after throwing up 3 to 4 times every single day, and he doesn't get nausea anymore. It didn't happen overnight, but one of the things that we had to fix, and this is kind of a clue, is we had to fix his liver because he had multiple liver enzymes that were elevated. Things were just really bad for him. So who loses their gallbladder? Now, this is in general. In general, guys, because I know someone's going to say, well, that's not me. Guys, there's outliers with everything. But in general, some of the things that you really have to consider is that, yes, females will lose their gallbladder more than males. And one of the reasons why is because of estrogen metabolism, or I should say estrogen's metabolism. All right, number 2, fair complexion. Well, what that means is that if you're white, if you are European, you're more likely to lose your gallbladder. I don't know if that is genetic as much as it just may be the way that they're actually eating and the common denominators when it comes to their lifestyle. The other thing is fat. Listen, we called this the 5 Fs. It might not be very politically correct, but you will see someone who is overweight. There's no doubt about it. And then also still fertile. So what that means is that this individual is still having a menstrual cycle. However, usually they're 40 or older. So you have female, fair complexion, fat, fertile, 40 or older. So who do you have? You have someone who is coming into, the end of their lifespan as far as their ability to be able to have kids. And it doesn't have anything to do with the fact that they are 40. It really has to do with, guys, by the time a woman is 40 or older, still having a menstrual cycle, and is overweight, has a high percentage of body fat, and then still has a higher amount of estradiol that their liver has to process every single month. Guys, this is the telltale sign of who's going to lose their gallbladder. Now, once again, there are outliers with everything, because I even know men that have lost their gallbladders as well. What's interesting is those men that I've seen that have lost their gallbladders actually had a high amount of estradiol in their body as well. So they had a high amount of estrogens in their body, which is really interesting because the liver is what is allowing you to be able to metabolize and be able to get rid of your estrogens, and it gets rid of it actually through the bile and the gallbladder. So it's really interesting. Now, so the biggest thing that I will tell you is this, is that the number one cause of you having an issue with your gallbladder is the fact that you have a fatty liver. Dr. Nate, how did I lose my gallbladder? You had a fatty liver. And this affects your bile production, the ability of the bile to be able to go into the gallbladder. It has so much, because once that liver gets damaged, inflamed, and fatty, there are so many things that can go wrong, including, ladies, your ability to be able to burn fatty acids as an energy source, and also includes your body's ability to be able to detox from your hormones every single month. Yes, detoxification is real, and yes, people do need help with their detoxification pathways. And please don't listen to anybody who says you don't need to detox. I will say one aspect says you don't ever need a detox because your liver does it. I'm like, well, what happens if your liver is fatty, inflamed, and damaged? The other aspect says, detox with me. All you need is this ionic foot bath and to take this smoothie and everything is good. And I say both of you are actually wrong. You have to understand that basically when it comes to healing the liver, it's actually rebuilding the liver, and it's helping to feed specific pathways to a detox pathways, which is basically a lot of different enzymatic functions taking place within the liver. So if you've gotten your gallbladder out, guys, and again, let me remind you, please share this, because this will help you understand why so many ladies have some of these symptoms, and men too. So here's symptoms, biggest symptoms after you had your gallbladder removed. So number one, diarrhea or having loose stool. Dr. Nate, why is that? I've had so many ladies who have, basically what is called anal leaking. And the reason why is because now they don't have a storage tank and their liver is just basically spitting out bile all the time. Now remember this, guys, bile is nasty stuff, because in that bile, you're also going to have things that you have detox from. So it's not very good. And in fact, when we do, in fact, detox people, one of the things that they notice is because we will stimulate the gallbladder to contract in order to remove what we're removing from the body. And they'll say, man, I got diarrhea, I had loose stool. And I'm saying that's exactly what's supposed to happen, because there's a lot of nasty stuff within that bile. So diarrhea and loose stool primarily, though, is going to be because you cannot break your fats down. Remember, you don't have the storage tank anymore. And so if you eat a meal that's high in fat, even if it's healthy fat, then you do not have the bile to be able to break down the fat. So you end up having a lot of undigested fat within the intestines, which then will irritate the lining of the gastrointestinal system. And the lining, when that happens, the body says, you know what, this isn't good, get rid of it. Which is why so many people think that throwing up and diarrhea, having a fever is so bad. It's the body getting rid of stuff that it doesn't need that can actually cause damage within the body. So diarrhea, loose stool, they call it anal leaking, as well. The second thing is dry skin. So a lot of women will say, man, I had my gallbladder out, things were good for a couple of weeks, and I just started getting just really, really dry, itchy skin. And why is that? Well, when you get your gallbladder out, your ability to be able to break down and absorb fats significantly goes down. And I want you to think about it. Fat is so critical, and it's critical to the skin. It's critical for brain function. It's critical actually for your hormones. And you are not able to absorb fats the way that you're supposed to, which a lot of times where you see it is you start to see it within the skin. You're also going to have an A, D, E, and K deficiency, because these are carried within fats, and you need these in order the bile in order to be able to absorb these fat soluble vitamins, which is why almost every single woman will have a vitamin D deficiency. I don't see very many women who have had their gallbladder removed who have adequate levels of vitamin D, which should be 60 to 70 up to 80 nanograms. So how many times did the doctors say, yeah, you're going to be vitamin D as well? So that can affect your immune system. That can affect your ability to be able to handle viral infections. That can actually affect autoimmunity as well. So there's so many different things that could go wrong. And then on top of that is you can develop what's known as small intestinal bacterial overgrowth. Wow. So many people are trying to fix their gut. I've been trying to fix my gut for the last 3 years. It shouldn't take that long to fix the gut. But that bacteria is actually regulated by bile acids. So if you can't actually be able to make enough bile acids to be able to absorb your fats or be able to release a large amount, then typically one of the things that you're going to see is you're going to see a small intestinal bacterial overgrowth. This is why when you're trying to handle those things, everyone wants to go in and try to kill some things off. And I'm like, you need a healthy north end of your gastrointestinal system with enough stomach acid and enough bile, and because that is what regulates what happens on the south end of the gastrointestinal system. Now, you guys might have a hard time actually seeing this, but this is actually a young woman who got her gallbladder out. Okay, now there's a couple of things actually going on. Is like, number one, you actually see a scoliosis. This is an X-ray looking at them from the back, so you can see the left hip, here's the right hip, here's the liver up here, and then you can see the stomach and you can see the intestines right in through there. So number one, guys, you can actually research and you will see that when there's a curvature or a scoliosis, how it affects the gastrointestinal system. This woman had tremendous problems. You would think it would be with diarrhea, but she had her gallbladder out, and she didn't have, after she got her gallbladder out, didn't have a normal bowel movement for about 2 weeks, if you can imagine that. One of the things, she also had Hashimoto's. In fact, we saw her antibody levels up at about 4,600, which is an incredible level. But her, and that actually got a lot better. Actually was able to lose a lot of weight. But then she said, I'm still having some issues when it comes to constipation. And we were only able to have her get about a bowel movement about every 3 days or so. And here's what's so interesting is because you can see how much bowel gas there is on this side. And so we did a stool test, and this actually has to be with the fact that she got her gallbladder out, because even sometimes it can cause issues with constipation. And when we looked at this, she had a tremendous, like I've never seen it this high, of a specific type of bacteria called Methanobacter smithii. Okay, so Methanobrevibacter smithii. Sorry, I mispronounced it. Sometimes I make a mistake. And the levels were just incredibly high, off the charts. But what's interesting about this is if you look at the first part of this specific type of bacteria in its name, it's methane. Okay, methane. So what does methane do? So these bacteria, they give off methane, and when they're present within the colon, they tend to paralyze the smooth muscle that allows for contraction to be able to move basically feces through the large intestine to be able to have a bowel movement. When it's that high, it's typically just paralyzing those muscles so they aren't able to contract to have a normal peristaltic movement through the intestines to be able to have bowel movements. Okay, now it's actually getting better. We had to do some things that were kind of like natural fire department things that are going on. But remember, she also lost her gallbladder and had gallbladder symptoms for a long period of time before she finally actually got it out. Now, here's someone who had their gallbladder out before coming to me, and I want to say about 25 to 30 years prior. Now, one of her biggest things that she had was she had literally diarrhea and loose stool all the time, and she couldn't even hold it in. And in fact, she had to wear a diaper, or it depends, all the time. And so you can see what happened by looking at this. And this is a great test. It's Genova stool test, and it will measure these different pillars. And so you can see maldigestion. So she's got a lot of fecal fat, some fat in her bowel movements because she wasn't absorbing it very well. And the reason why is because she wasn't on a bile acid replacement. Stay tuned for that. Number two, a lot of inflammation taking place along the gastrointestinal barrier called secretory IgA. She had dysbiosis, which means dysbiosis is basically, think of small intestinal bacterial overgrowth, or things that aren't supposed to be growing are growing, and things that are supposed to be there aren't at all. And it has to do with the environment of not having the gallbladder especially. And then you can see actually metabolic imbalance and infection was actually fine. Now this is about 5 months later, and you can see, well, we got her fecal fats to be normal. One of the reasons why is because she was taking a bile acid replacement at every meal to help her break down her fats. Her skin also improved as a result. You can see her secretory IgA starting to go down. And then you see with dysbiosis is you see that all of this is getting better. In fact, they assign a score of 10 and then down to 2. And then you can see as a result how the body was starting to change and starting to adapt. And we started to have to add in some things in order to help feed the new bacteria that were starting to populate, called basically things like chicory root, things like potato starch, basically known as resistant starches. Now, when we got to this point, the cool thing is she said, I'm not wearing a diaper anymore. And so her abnormal bowel movements, her loose stool, diarrhea, things like that went way down. Now, is it perfect? No. And she'll have to work on it long, but she's always going to be at basically at a disadvantage because she doesn't have her gallbladder anymore. Okay. So let me ask you guys something. For those of you who have had your gallbladder out, did your doctor tell you to go on pancreatic enzymes or a bile replacement? The reason why I say this is pancreatic enzymes, specifically lipase, helps you to break down your fats, okay? And a bile acid replacement also helps you to emulsify your fats. It actually helps to break down the fats so that the pancreatic enzyme known as lipase can then start to break it down even further. Now, sometimes if you don't have a gallbladder, you definitely need to be on a bile acid replacement. Some people also need to be on a pancreatic enzyme as well. How do you know that? Well, you test. So what's a bile replacement? Well, basically it's ox bile. So it's the bile that comes from an ox, and you take it when you eat foods, because when you are, especially with meals, because when you're having meals and there's fat, you need something, an increase in bile, to be able to help you break down and emulsify your fats, okay? So that's one of the biggest things. But I've never ever seen a doctor sitting someone down after surgery and saying, here's some ox bile that you need to be on. And anytime that you have a meal that contains fat, you better be taking this, or you're going to see some really bad things happen south of the gallbladder into the small intestine and into the large intestine as a result of removing your gallbladder. Now, full disclosure, do some people need their gallbladder out? Yes, because the gallstones are so big that sometimes you can't do things in order to help break it down. And sometimes they're in a 911 situation where the stone is actually blocking the duct, and they'll have a really bad day, and yes, death can even occur if they don't remove the gallbladder. 911. But when a doctor says, this is what breaks my heart, because I ran into a guy today that says, yeah, I had my gallbladder out. He didn't need to. They were just doing a surgery for something else, and they just removed it and said, hey, thank you you're welcome very much. We took this out. You don't really need it anyway. There is not one organ in your body that you don't need. That also includes the appendix. It also includes the gallbladder. Just remember this. Just because we haven't figured out the full function of an organ, we shouldn't be so egotistical to think that it's not there for a reason. So let me ask you guys, did your doctor tell you to go on pancreatic enzymes and or a bile replacement? Okay. Now I want to say this. Even if they take out the gallbladder, guys, then your problems aren't done. Okay. There's still the physiology that created the problem in the first place. So losing your gallbladder really was a liver issue, and it's a fatty liver issue. And the gallbladder was not the problem. You were feeling the problem. That was where the symptom was, but it wasn't the real reason why you had the problem. The gallbladder was just the symptom. It's no different than cutting out the tongue of a baby because they're crying. Well, you got rid of the symptom, but figure out the reason why the baby is actually crying. So the thing is guys, if you get your gallbladder out, your problems aren't over, because I'm going to guarantee you have other problems that are related to your liver, like your estrogen metabolism, like your ability to be able to burn fatty acids as an energy source. And this is why these problems still persist. You may feel better getting your gallbladder out, but you are destined to have other problems because you didn't fix the reason why it was happening, and that's in the liver. So what are you doing about your liver, okay? What are you doing about the liver? So here's what you can do, okay? Number one, get tested by a Wellness Way doctor. Please get tested. Well, what test do you need to get? Let them decide that for you, okay? So yes, food allergy testing is important. Yes, stool testing is important as well. Yes, Dutch testing can be very important. And yes, even blood hormone testing can be very important. And yes, even thyroid testing can be very important. And yes, there's about 18 markers that you need to be looking at in order to properly assess the thyroid. Get on a bile replacement, possibly even a pancreatic enzyme. You may also need to be on betaine hydrochloric acid and start taking that about 5 minutes before meals. Yet, I know it sounds like an inconvenience, but you know what is an inconvenience? Having loose stool, running to the bathroom all the time, possibly having to wear a diaper, and having dry, itchy skin, and not having absolutely no energy and being vitamin D deficient. That's going to affect your immune system and affect and regulate an autoimmune response. And then also address the liver, address the reason why it happened in the first place, which is why, yes, testing all of your estrogens with either blood or Dutch testing, and also testing for the thyroid, because here's what a lot of people don't realize. I told a woman this. She said, I've been on a thyroid medication for like 20 years. I need to tell my doctor why I have these thyroid problems, and I don't think that he's going to believe me. And I said, well, tell your doctor is that you're taking basically Synthroid, and you have a high amount of T4, but you have a very low amount of active T3. Guess where that conversion takes place? The gastrointestinal system and the liver. You don't have a thyroid problem. What you have is you have a conversion problem, and it's happening from the liver. And I guarantee if you did an ultrasound on your liver, you're going to have a swollen, inflamed, fatty liver. So fix the liver. And any doctor worth their weight in salt should be guiding and leading a patient through helping them to get off of medications versus just throwing them another medication and not giving them any kind of hope and telling them that there is no hope, there's nothing that you can do. And if you don't know, doctor, then please refer them to someone who does, because it's the patient who should take priority over your ego. I'm sorry that I have to say that, but every day I'm dealing with this all the time, and we're the ones actually helping the patient. And the problem is that the doctors, they bash the patient, they bash the person that helped to get them well, and meanwhile, people continue to stay sick. And I'm sick of it, and I'm so tired of that happening. We get into the profession to help people, and it's somewhere along the way we got lazy, we stopped learning, we stopped thinking, and we just get in this one-track mind that this is the only way it has to be. And in reality, who suffers? The patient does, the person does. Our goal as doctors should be to do everything in our power to alleviate the suffering of the person in front of us, and yet we let our egos get in the way because we're afraid that there could be a different perspective. I'm sorry for going on that tangent, but when I see people who are suffering so much, for me, this is why it's 8 o'clock at night and I'm talking to you guys, because people shouldn't be suffering. And we could be helping so many people. So many people were willing to look at it from a different perspective, especially. So there's no such thing, though. I'm going to tell you guys something because I get messaged all the time. What should I take for this? Guys, there's no such thing as a magical, recently discovered, fix all my problems supplement, guys. And if you think that this magical berry that was recently discovered in the Amazon rainforest in Ecuador, and it's going to take away all your problems, I'm sorry, you are sadly mistaken, and you're getting taken as a fool. There is no such thing as a magically recently discovered fix all my problems supplement, guys. There are some incredible supplements out there, but guess what? It does not work if you are not working on actively fixing your lifestyle. So guys, supplements, they guide, supplements nurture, but they do not manipulate like a lot of these medications that are actually out there. But let me ask you a question. Do you want to be restored or do you want to be manipulated? And if you want to be restored, please give me a like right now. Please give me a like if you want to be restored and that you are sick and tired of being manipulated with medications that do not solve the problem. Yes, they put out fires, but you are not getting a carpenter to rebuild and repair the body afterwards, okay? So, guys, please reach out to thewellnessway.com and see if you can find a doctor who will be willing to work with you. For those of you who are in the Chicagoland area, yes, coming up a week from tomorrow, which is going to be May 10th, we are having our approach to inflammation. People reach out all the time, say, how do I become a new patient? Come to the approach to inflammation talk Tuesday, 6:15 p.m. At our office. This is an in-person event. The reason why we do that, guys, is because when you understand that the first role is lowering inflammation, it makes your job and it makes my job so much easier. There's less of a gap that we have to bridge when it comes to understanding what you need to do in order to start the process of lowering inflammation. And remember this, guys, you will not heal unless you lower inflammation. It's like saying, why isn't the scab in my knee healing? Well, because first and foremost, you keep falling on it every single day. So what we need to do is lower the inflammatory triggers. We need you to stop falling onto your knee and re-injuring that knee and causing the scab to open up and become inflamed again. And once you guys understand that healing is possible when your body is not in an inflammatory state, that just starts the process of you getting restored, of you getting rebuilt, and of you getting repaired. So again, guys, thank you so much for joining for me. Make sure that you guys follow me on TikTok, Rumble, YouTube. You'll see this video on some of those platforms coming up later on in the week, and I'll also do a short format video on TikTok probably tomorrow that it will explain what I went over in 2 to 3 minutes. But again, anytime I do a short video, it will always get misconstrued by the trolls, all right? But you'll see, I won't respond to the trolls. Don't feed the trolls. Understand them that, remember, hurt people, okay? So guys, I appreciate all the likes. I appreciate all the shares. I appreciate all of you that watch. I'm humbled that anybody will want to listen to me. So thank you again for very much for everything. And guys, I hope you have a great rest of your night. Hope you have a great week. And we will talk to you guys very soon.